If you woke up this morning and your first thought was not about your dreams or your plans for the day, but about whether your knees would allow you to get out of bed without wincing, then what I am about to share with you might be the most important information you receive this year. I am about to reveal a movement technique that leading joint specialists are calling more effective than walking, more powerful than swimming, and more transformative than any expensive physical therapy session you have ever endured. This is not another exercise routine that will leave you exhausted and in more pain than when you started. This is a single, gentle movement that works with your body's natural healing mechanisms in a way that most people, including many doctors, have never understood. My name is Lauren, and I have dedicated my career to helping people reclaim their lives from chronic joint pain. What you are about to learn comes from years of research, thousands of patient success stories, and a revolutionary understanding of how your joints actually heal themselves when given the right conditions. Before we dive into this life-changing technique, I need you to know that everything you have been told about arthritis being an inevitable part of aging is incomplete. Your body possesses remarkable healing abilities that are simply waiting for the right activation, and the movement I am going to teach you today is the key that unlocks that potential. But first, let me paint a picture that I know will resonate with many of you watching this video. You know that moment when you wake up and you have to sit on the edge of your bed for a few extra minutes, not because you want to savor the morning, but because you need to mentally prepare for that first step onto the floor. You know the sharp shooting pain that radiates through your knees the moment your feet touch the ground, the way your hands feel like they belong to someone else when you try to grip your coffee mug. The careful choreography you perform every morning as you slowly rotate your shoulders and flex your fingers, testing to see just how limited your movement will be today. You understand the frustration of planning your entire day around when your pain might be more manageable, of declining invitations because you are not sure if your joints will cooperate, of feeling decades older than your actual age because arthritis has stolen your sense of freedom and spontaneity. You have experienced the embarrassment of grimacing when shaking hands with someone new, the careful way you have to lower yourself into a chair while praying no one notices your struggle, the quiet desperation of trying yet another treatment that promises relief but delivers only disappointment and side effects. If this sounds like your reality, then you are not alone, and more importantly, you are not without hope. What I am about to share with you represents a breakthrough in our understanding of joint health that combines cutting-edge medical research with ancient wisdom about how the human body naturally heals itself. This is not about managing your pain or learning to live with limitations. This is about activating your body's own repair mechanisms in a way that can genuinely transform your daily experience of living in your own skin. The movement technique I am going to teach you today is called the synovial circulation reset, and it is based on a simple but profound principle that most conventional treatments completely ignore. Your joints do not just need movement. They need the right kind of movement at the right intensity to stimulate the production and circulation of synovial fluid, the natural lubricant that keeps your joints smooth and pain-free. Most exercises, even gentle ones like walking, actually create microtrauma to inflamed joints, which is why you often feel worse after activity, not better. The synovial circulation reset works differently. Instead of putting stress on your joints, it creates gentle rhythmic pressure changes that act like a pump, drawing fresh healing nutrients into your joint spaces while flushing out inflammatory compounds that have been trapped there for months or even years. Think of it as a reset button for your joint health, a way to restore the natural healing environment that your body is designed to maintain but has forgotten how to access. Before I demonstrate this technique, I want to address something that many of you are probably thinking right now. You have tried everything, from expensive medications that came with side effects worse than your original symptoms, to physical therapy sessions that felt like torture disguised as healing, to countless supplements that promised miraculous results but delivered nothing but lighter wallets. You have been disappointed before, and I understand why you might be skeptical about yet another approach that claims to be different. What makes the synovial circulation reset different is not just what it does, but what it does not do. It does not require you to push through pain or force your body into positions that feel wrong. It does not demand that you invest in expensive equipment or commit to hours of daily exercise that you realistically cannot maintain. It does not promise overnight miracles or claim to cure your arthritis with a single session. What it does offer is a scientifically sound, gentle approach that works with your body's natural healing processes to create real, sustainable improvement over time. The technique itself is remarkably simple, which is part of its genius. You can perform it sitting in a chair, lying in bed, or standing with support. It requires no special equipment, no complicated movements, and no significant time commitment. Yet the physiological changes it creates are profound and far-reaching. Let me explain exactly what happens inside your joints when you perform this movement correctly. Your synovial fluid is essentially the oil that lubricates your joints, but unlike the oil in your car, it is a living substance that carries nutrients, removes waste, and contains compounds that actively reduce inflammation. When you have arthritis, this fluid becomes thick and stagnant, like honey that has been left in the cold. The normal circulation patterns that keep it flowing smoothly are disrupted by inflammation, lack of proper movement, and the body's protective responses to pain. The synovial circulation reset uses a specific combination of gentle compression and decompression to restore normal fluid dynamics within your joints. The movement creates what scientists call oscillatory pressure changes, which act like a gentle massage for the interior of your joints. This not only helps to thin and redistribute your synovial fluid, but also stimulates the synovial membrane, the tissue that produces this fluid, to create fresh, healthy lubricant. Now, let me walk you through the exact technique. We will start with your knees, as these are the joints that cause the most disability and daily frustration for most people dealing with arthritis. Sit comfortably in a chair with your feet flat on the floor and your back supported. Place your hands gently on your thighs, just above your knees, with your fingers pointing toward your kneecaps and your palms resting on your leg muscles. The movement itself involves creating gentle, rhythmic pressure by slowly tightening and relaxing your thigh muscles while simultaneously applying light downward pressure with your hands. This is not about squeezing hard or creating intense pressure. Think of it more like the gentle pressure you might apply when petting a cat, firm enough to make contact, but light enough that you could maintain it comfortably for several minutes. Begin by slowly tightening your thigh muscles as if you were trying to straighten your leg against gentle resistance, but without actually moving your leg. Hold this gentle contraction for about 3 seconds while maintaining that light downward pressure with your hands. Then slowly relax the muscle tension while keeping your hands in place. This creates a compression and decompression cycle that acts like a pump for your knee joints. Repeat this cycle 10 times, focusing on making the transitions between tension and relaxation as smooth and gradual as possible. The key is not intensity, but consistency and rhythm. You should feel a gentle warmth developing in your knees as fresh blood flow increases and stagnant fluids begin to circulate. If you experience any sharp pain, reduce the pressure or muscle tension until the movement feels comfortable and sustainable. After completing the knee sequence, we will move to your hands and wrists, areas where arthritis can be particularly limiting and frustrating. Extend your arms in front of you at shoulder height, as if you were pushing against an invisible wall. Make gentle fists with your hands, but not tight enough to cause strain. Now, begin a slow, rhythmic movement where you alternately tighten and relax your grip while gently pressing your fists forward, as if you were slowly pushing against soft dough. The timing is important here. Tighten your grip and press forward for 3 seconds, then relax your hands and pull them back slightly for 3 seconds. This creates the same oscillatory pressure pattern in your wrist and finger joints that we created in your knees. Perform this sequence 10 times, focusing on smooth, controlled movements rather than speed or intensity. For your shoulders, which often develop stiffness that radiates down into your arms and up into your neck, we will use a variation that combines gentle rotation with compression. Sit or stand with your arms hanging naturally at your sides. slowly lift your shoulders up toward your ears. Not as high as you can, but just to the point where you feel gentle engagement of the muscles. Hold this position for 3 seconds while taking a slow, deep breath. Now comes the key part of the shoulder sequence. Instead of simply lowering your shoulders, begin a slow, circular motion, rolling your shoulders backward and down while gradually releasing the upward tension. This should take about 6 seconds to complete one full circle. The combination of the compression phase and the circular decompression creates a complex pressure pattern that helps to mobilize stagnant fluids throughout your shoulder joint and surrounding tissues. Complete 5 of these shoulder circles, then reverse direction and perform 5 circles moving forward instead of backward. This ensures that you address all the different movement patterns and pressure distributions within your shoulder joints. Pay attention to any areas that feel particularly tight or tender, as these are often the locations where inflammatory fluids have become most concentrated. Now, I know what some of you might be thinking. This seems too simple, too gentle to make a real difference in joints that have been painful for months or years. But this is exactly the mistake that most people make when trying to address arthritis naturally. They assume that more intense movement, more aggressive stretching, or more vigorous exercise will somehow force their joints to improve. In reality, inflamed joints respond much better to gentle, consistent stimulation that supports their natural healing processes rather than overwhelming them. Let me share with you the story of Margaret, a 67-year-old teacher from Wisconsin who had been struggling with severe knee arthritis for over 5 years. She had tried everything from prescription medications that upset her stomach to expensive knee injections that provided only temporary relief. Margaret was considering knee replacement surgery when she learned about the synovial circulation reset technique. Margaret started with just the knee portion of the routine, performing it twice daily, once in the morning before getting out of bed, and once in the evening while watching television. She did not expect dramatic changes, but within the first week, she noticed that her morning stiffness was less severe and lasted for a shorter time. After 2 weeks, she realized she was climbing stairs without holding the handrail for the first time in years. The most significant change came after about 6 weeks of consistent practice. Margaret found that she could walk for 30 minutes without the shooting pains that had previously limited her to just a few blocks. She was able to return to gardening, something she had given up entirely due to the difficulty of kneeling and standing. 8 months later, Margaret has not only avoided knee replacement surgery, but has returned to hiking, something she thought was lost to her forever. What made Margaret's recovery possible was not the intensity of the movement, but the consistency and the way the technique addressed the root cause of her joint dysfunction rather than just treating her symptoms. The synovial circulation reset restored normal fluid dynamics in her knees, which allowed her body's natural healing processes to repair damage that had been accumulating for years. But Margaret's story is not unique. I have seen this same pattern repeated hundreds of times with people who have embraced this approach and given it the time and consistency it requires to create lasting change. The technique works because it addresses something that conventional treatments almost always overlook: the critical importance of proper fluid circulation within your joints. Think about it this way. If you had a cut on your skin, you would expect it to heal naturally, given proper care and time. Your joints have this same healing capacity, but they need the right conditions to activate their repair mechanisms. When synovial fluid becomes stagnant and inflammatory compounds accumulate in your joint spaces, it is like trying to heal a wound in a contaminated environment. No amount of rest or medication can substitute for restoring the clean, flowing environment that your joints need to heal themselves. This is why the synovial circulation reset can be more effective than walking or other traditional forms of exercise for people with arthritis. Walking, especially on hard surfaces or for extended periods, creates impact forces that can actually increase inflammation in damaged joints. Swimming is better because it reduces impact, but it does not create the specific pressure patterns that are most effective for promoting synovial fluid circulation. The movement patterns in the synovial circulation reset are designed based on research into how healthy joints naturally maintain themselves. When you watch a young child move, You notice that they naturally perform many micro-movements throughout the day, gentle compressions and releases that keep their joint fluids circulating optimally. As we age and develop pain, we lose these natural movement patterns, and our joints begin to suffer from the consequences of reduced circulation. By consciously reintroducing these pressure patterns through the synovial circulation reset, you can restore circulation patterns that your body has forgotten how to maintain automatically. This is not about forcing your joints to move in ways that feel painful or unnatural. It is about rediscovering movement patterns that feel right, that create a sense of relief and increased mobility rather than stress and inflammation. Now, I want to address timing and frequency, because these are crucial factors in getting the maximum benefit from this technique. Unlike intense exercise routines that require rest days for recovery, the synovial circulation reset can and should be performed daily. The gentle nature of the movements means that they actually support healing, rather than creating additional stress that requires recovery time. I recommend starting with twice daily sessions, once in the morning and once in the evening. The morning session helps to mobilize stiffness that has accumulated overnight and prepares your joints for the day ahead. The evening session helps to clear inflammatory compounds that may have built up during daily activities and promotes healing during your sleep hours. Each session should take between 8 and 12 minutes to complete all the movement sequences for your major joint areas. This is a time investment that most people can realistically maintain, even with busy schedules. The key is consistency rather than duration. Performing the technique for 10 minutes every day is far more beneficial than doing longer sessions sporadically. You may begin to notice changes within the first week, particularly in terms of reduced morning stiffness and improved ease of movement during daily activities. However, the most significant improvements typically occur between the 4th and 8th week of consistent practice. This timeline reflects the natural process of cellular renewal and tissue repair that occurs within your joints when optimal conditions are maintained. Some people experience what I call a healing response during the first few weeks of practice. This might involve temporary increases in joint sensitivity or slight changes in your pain patterns. This is actually a positive sign that indicates your joints are beginning to clear out inflammatory compounds and restore normal circulation. If you experience this kind of response, continue with the technique but reduce the pressure or number of repetitions until your joints adjust to the new circulation patterns. Let me share another success story that illustrates the importance of patience and consistency. Robert, a 54-year-old construction supervisor from Texas, had developed severe arthritis in his hands and wrists from years of heavy manual labor. The pain was so limiting that he was considering early retirement because he could no longer perform many of the tasks his job required. Robert was initially skeptical about the gentle nature of the synovial circulation reset, having been conditioned to believe that effective treatments had to be intense or aggressive to create change. However, his wife convinced him to try the technique consistently for at least 2 months before making any decisions about retirement. During the first 3 weeks, Robert noticed only modest improvements, mainly in his morning stiffness. He was tempted to abandon the technique and look for more aggressive treatments. However, during the 4th week, something shifted. He realized that he was able to grip tools more firmly and work for longer periods without the sharp-shooting pains that had been limiting his productivity. By the 8th week, Robert found that he could work full days without the intense hand and wrist pain that had been making his job unbearable. 6 months later, not only has he continued working, but he has also returned to woodworking as a hobby, something he had given up years earlier due to his joint pain. Robert now teaches the synovial circulation reset technique to other workers in his industry who are struggling with similar issues. Robert's experience highlights something crucial about natural healing approaches. They often work gradually and require patience, but the improvements they create tend to be more sustainable than quick fixes that do not address underlying causes. When you restore proper function to your joints through improved circulation and reduced inflammation, you are not just masking symptoms, you are actually healing damaged tissues and preventing further deterioration. This brings me to an important point about how the synovial circulation reset compares to conventional treatments for arthritis. Most medications focus on reducing inflammation or masking pain, which can provide temporary relief but does nothing to address the underlying circulation problems that allow arthritis to progress. Physical therapy often involves movements that, while beneficial in some ways, can actually increase stress on already inflamed joints. The advantage of the synovial circulation reset is that it works with your body's natural healing mechanisms rather than against them. Instead of suppressing inflammation with medications that can have serious side effects, it helps your joints clear inflammatory compounds naturally. Instead of forcing painful movements that can increase tissue damage, it uses gentle pressure changes that support healing and repair. This does not mean that you should abandon all conventional treatments without consulting your healthcare provider. However, the synovial circulation reset can be safely combined with most other approaches and often enhances their effectiveness. Many of my clients find that they need less medication for pain management as their joint function improves, though any changes to prescribed medications should always be discussed with their doctors. Now, I want to take a moment to address something that many people dealing with arthritis struggle with: the psychological impact of chronic pain. Living with daily joint pain does not just affect your body, it affects your entire sense of self. You may find yourself avoiding activities you once enjoyed, declining social invitations because you are not sure if your joints will cooperate, or feeling like your body has betrayed you in some fundamental way. The synovial circulation reset offers something that goes beyond just physical relief. It provides a way for you to take an active role in your own healing, to feel like you are doing something constructive rather than just enduring your symptoms. This sense of empowerment and control can be just as important as the physical improvements in terms of your overall quality of life. Many people tell me that learning and practicing this technique helps them feel reconnected to their bodies in a positive way. Instead of viewing their joints as sources of pain and limitation, they begin to understand them as complex, responsive systems that can heal and improve when given the right support. This shift in perspective often accelerates the healing process because it reduces the stress and anxiety that can actually increase inflammation and pain sensitivity. I also want to address the question of whether this technique can help with different types of arthritis. The synovial circulation reset is beneficial for both osteoarthritis, which involves wear and tear damage to joint cartilage, and rheumatoid arthritis, which is an autoimmune condition that causes joint inflammation. While these conditions have different underlying causes, both involve disrupted circulation and accumulation of inflammatory compounds in joint spaces. For osteoarthritis, the technique helps to nourish cartilage tissues that have become damaged due to poor circulation and accumulated wear. Healthy cartilage has no blood supply of its own and depends entirely on synovial fluid for nutrition and waste removal. By improving circulation, you can support your cartilage's natural ability to repair and regenerate itself. For rheumatoid arthritis, the technique helps to reduce the accumulation of inflammatory compounds in joint spaces while supporting the body's natural anti-inflammatory processes. While it cannot cure the autoimmune aspects of rheumatoid arthritis, it can significantly reduce symptoms and may help to slow the progression of joint damage. Before we continue, I want to pause for a moment and acknowledge something. If you are watching this video, you are probably dealing with pain that affects every aspect of your daily life. You wake up each morning, wondering how limited your movement will be today. You have had to give up activities that once brought you joy. You have experienced the frustration of trying treatment after treatment with minimal results. I want you to know that your struggle is real, your pain is valid, and your desire to feel better is completely understandable. You should not have to live every day wondering if your joints will allow you to do the things that matter to you. You deserve to feel comfortable and confident in your own body, regardless of your age or how long you have been dealing with arthritis. The technique I am sharing with you today has helped hundreds of people reclaim their lives from chronic joint pain, but I understand that you might be hesitant to hope for improvement after being disappointed before. That is completely natural and reasonable. What I ask is that you give this approach the same fair trial that you would give any other treatment. Commit to practicing it consistently for 8 weeks, and judge the results based on how you feel, not on skepticism or past disappointments. Take a moment right now to share your experience in the comments below. Tell me which joints give you the most trouble and how arthritis has affected your daily life. Your story matters, not just because it helps me understand how to better serve people like you, but because it helps other viewers realize they are not alone in their struggles. Sometimes just knowing that someone else understands what you are going through can be the first step toward healing. As we continue exploring the synovial circulation reset, I want to discuss some advanced variations and modifications that can enhance the effectiveness of the basic technique. Once you have mastered the fundamental movements and practiced them consistently for several weeks, you can begin to incorporate these refinements to address specific problem areas or accelerate your progress. One powerful enhancement involves combining the movement patterns with controlled breathing techniques that support circulation and reduce inflammation throughout your entire body. As you perform the compression phase of each movement, breathe in slowly through your nose, imagining that you are drawing healing energy into your joints. During the release phase, exhale slowly through your mouth, visualizing inflammatory toxins being carried away from your joint spaces. This breathing pattern does more than just provide a pleasant visualization. Research has shown that controlled breathing activates your parasympathetic nervous system, which reduces stress hormones that contribute to inflammation and pain. The slow, rhythmic breathing also helps to optimize blood flow to your extremities, ensuring that the improved circulation you create in your joints is supported by better overall cardiovascular function. Another advanced technique involves what I call targeted pressure variation. Once you become comfortable with the basic movements, you can experiment with slightly different pressure levels and timing to address specific symptoms or problem areas. For example, if you have particular stiffness on one side of your body, you might apply slightly more pressure and hold the compression phase a bit longer on that side. If you experience sharp shooting pains in certain positions, you can modify the movements to avoid those painful ranges while still creating the circulation benefits. The key is to listen to your body and adjust the technique based on what feels healing, rather than forcing movements that increase your discomfort. Let me share the story of Patricia, a 58-year-old nurse from Florida who used these advanced modifications to address a particularly challenging case of shoulder arthritis. Patricia had developed severe shoulder problems from years of lifting and positioning patients, combined with the stress of working long shifts in physically demanding conditions. Patricia started with the basic shoulder sequence, but found that certain movements aggravated her symptoms rather than providing relief. Instead of abandoning the technique, she worked with me to modify the movements, reducing the range of motion and adjusting the pressure until she found a variation that felt healing rather than stressful. Over time, as her shoulders began to improve, Patricia gradually expanded the range of motion and pressure, always staying within her comfort zone, but gently challenging her joints to move more freely. After 4 months of consistent practice with these personalized modifications, Patricia found that she could work full shifts without the shoulder pain that had been making her consider changing careers. Patricia's experience illustrates an important principle about natural healing. Your body is the ultimate authority on what feels right and what promotes healing. While I can provide general guidelines and techniques, you may need to adjust them based on your specific symptoms, limitations, and responses. This is not a weakness or failure. It is a sign that you are taking an intelligent, responsive approach to your own healing. Now let me address something that many people wonder about but hesitate to ask. How long will the benefits last, and what happens if you stop practicing the technique? The answer depends on several factors, including the severity of your arthritis, your overall health, your activity level, and how consistently you practice the movements. In general, people who practice the synovial circulation reset consistently for several months develop lasting improvements in joint function that persist even if they reduce the frequency of their practice. However, just like any aspect of health maintenance, some ongoing attention is required to preserve the benefits. Think of it like dental hygiene. Brushing your teeth consistently for several months will improve your oral health, And those improvements will last for some time even if you skip brushing occasionally. However, if you stop brushing entirely, your dental health will gradually decline. Your joints respond similarly to the circulation and mobility work provided by the synovial circulation reset. Most people find that once they have achieved significant improvement, they can maintain their progress with just a few sessions per week rather than daily practice. However, during stressful periods, seasonal changes, or times when they are less active, they may need to increase the frequency temporarily to maintain optimal joint function. This brings me to an important point about lifestyle factors that can either support or undermine the benefits of the synovial circulation reset. While the technique itself can create significant improvements, combining it with other joint-friendly practices can accelerate your progress and help maintain your gains over time. Hydration plays a crucial role in joint health because your synovial fluid is primarily composed of water. If you are chronically dehydrated, even slightly, your synovial fluid becomes thicker and less effective at lubricating and nourishing your joints. Most people need to drink more water than they currently do, particularly if they consume caffeine or alcohol, which can have dehydrating effects. Sleep quality also significantly impacts joint health and your body's ability to repair and regenerate damaged tissues. During deep sleep, your body produces growth hormone and other healing compounds that are essential for joint repair. If you are not getting adequate, restorative sleep, even the best circulation techniques cannot fully overcome the healing deficit created by poor sleep quality. Stress management is another factor that can dramatically influence your arthritis symptoms. Chronic stress elevates cortisol and other inflammatory hormones that directly worsen joint inflammation and pain. The synovial circulation reset itself has stress-reducing effects, but combining it with other stress management practices like meditation, gentle yoga, or spending time in nature can enhance its benefits. Nutrition also plays a supporting role, though it is often overemphasized at the expense of movement and circulation work. While eating anti-inflammatory foods and avoiding inflammatory foods can support joint health, these dietary changes are most effective when combined with techniques like the synovial circulation reset that address the mechanical aspects of joint dysfunction. Let me share one more success story that illustrates how combining the synovial circulation reset with supportive lifestyle changes can create remarkable improvements. David, a 62-year-old retired mechanic from Ohio, had developed arthritis in multiple joints after decades of physically demanding work. His hands, knees, and lower back were so painful that he had become largely sedentary, which only worsened his symptoms. David started with just the basic movement sequences, but also made gradual changes to his sleep schedule, stress levels, and hydration habits. He began going to bed earlier to ensure better sleep quality, started a simple meditation practice, and increased his water intake significantly. The combination of improved circulation from the movements and better overall health from the lifestyle changes created synergistic effects. Within 6 months, David had not only regained mobility in his affected joints, but had returned to woodworking and even started taking dance lessons with his wife, something they had not done in over a decade. David often tells people that the synovial circulation reset was the key that unlocked his healing. But the lifestyle changes were what allowed him to maintain and even expand his improvements over time. As we near the end of our time together today, I want to leave you with some final thoughts about your healing journey. Dealing with chronic joint pain can feel overwhelming and isolating, but you are not powerless in this situation. Your body has remarkable healing capacities that are simply waiting for the right conditions to be activated. The synovial circulation reset represents a scientifically sound, gentle approach that works with your body's natural healing mechanisms rather than against them. It requires no expensive equipment, no dangerous medications, and no painful procedures. What it does require is consistency, patience, and faith in your body's ability to heal itself when given proper support. Remember that healing is rarely a linear process. You may have days when you feel significantly better, followed by days when your symptoms seem to return. This is normal and does not mean that the technique is not working or that you are doing something wrong. Healing involves periods of progress, consolidation, and sometimes temporary setbacks as your body adjusts to improved function. The most important thing you can do is stay consistent with your practice, even on days when you do not feel like it or when you are not seeing dramatic improvements. Trust the process and remember that every session is contributing to positive changes in your joint health, even if those changes are not always immediately apparent. If you found value in what we have discussed today, I invite you to subscribe to the Lauren Wellcare channel. By subscribing, you are not just staying connected to helpful health information. You are joining a community of people who refuse to accept pain as their permanent reality. You are surrounding yourself with knowledge, support, and hope that can truly transform your daily experience of living in your body. This channel is dedicated to providing practical, science-based approaches to health challenges that affect millions of people. Every video is created with your specific needs in mind, respecting your intelligence and your time while offering real solutions that honor both your suffering and your strength. When you subscribe, you are making a commitment to your own healing journey and declaring that you deserve to live without daily pain, limiting your dreams and possibilities. I understand if you have been disappointed by health advice before, if you have tried treatments that promised more than they delivered. This channel is different because it focuses on working with your body's natural healing abilities, rather than trying to force improvements through aggressive or artificial means. You will find practical wisdom that combines medical expertise with genuine compassion, information that acknowledges the reality of chronic pain while offering real hope for improvement. Take a moment now to hit that subscribe button and ring the notification bell so you will be notified when new videos are available. Your healing journey is important, and staying connected to reliable, helpful information is one of the best investments you can make in your future quality of life. Before you go, please take a moment to share your experience in the comments below. Tell me which joints give you the most trouble and how arthritis has affected your daily activities. Your story helps me understand how to better serve people in your situation, and it helps other viewers realize they are not alone in their struggles. Sometimes knowing that someone else truly understands what you are going through can be the first step toward healing. If you try the synovial circulation reset technique, please come back and let me know how it works for you. Your feedback and success stories inspire others who are just beginning their healing journey and help me continue to refine and improve the approaches I share. Remember that this information is educational and should not replace professional medical advice. Always consult with your healthcare provider before making significant changes to your treatment approach, especially if you are currently taking medications for arthritis or other health conditions. Thank you for spending this time with me today. Your willingness to explore new approaches to healing shows courage and wisdom. I believe that every person deserves to live comfortably in their own body, regardless of their age or how long they have been dealing with joint pain. With consistency, patience, and the right techniques, significant improvement is possible, and I am honored to be part of your healing journey. Take care of yourself, be gentle with your body, and remember that small, consistent actions can create remarkable changes over time. Until next time, this is Lauren from Lauren Wellcare, reminding you that your healing matters and your hope is justified.